I'm State Representative Sue Shear, and we are doing a Zoom meeting live today for our Facebook constituents. And we have a special guest here today, Laura Pellikan, and she's going to have a very important conversation with us about the open enrollment period. That is a special period going on right now. So we will be getting to her and her questions. Before we begin, the reason that I wanted to reach out and do this is because I felt very drawn to the people who are struggling without having insurance and without being able to get on a plan. So many people right now have been losing their jobs, losing their insurance. So of all times, this is so very important. For some of you who might not have known, I have an award that I'm not really one to tout my awards, but this one is very near and dear to my heart. And this was for passing one of the first most important legislation in the state of Illinois for telehealth medicine. And in order for people to get telehealth medicine, obviously they're going to want to have insurance. And my bill was about this very thing, for insurance to pay on telehealth medicine. So I'm going to put this up by the screen and maybe you can see it. It's a very cool picture, and it's from a magazine cover called Radio News from 1924. And if you look at the picture, it's a patient and a doctor on the TV, which was right when this stuff was invented. Think about that, was almost 100 years ago. It reminds me kind of how the Jetsons were to see into the future. So that's very exciting to think that now we're not talking about the future, we're talking about the present. So without further delay, let's get started. So I'll let Laura explain her position and all that, and then we will do questions and answers. The questions will be based on the questions that you, my constituents, have called and asked me over the years.
Thank you, Rep. Chair, and good morning. My name is Laura Pellikan, and as Rep. Chair mentioned, I am the Executive Director of Get Covered Illinois. We are part of the Illinois Department of Insurance, and we are the ACA Health Insurance Market Plan for the state of Illinois. The marketplace, just as a refresher, enables people to purchase health insurance. It's also the only way for Illinois citizens to purchase quality, subsidized insurance in the form of tax credits.
Okay, thank you very much and welcome, and it's very exciting to have you here. So I'm going to just read through the questions that I had time to think about beforehand, and we wanted to make sure we had accurate answers. So I will be reading these right off of my my paper here. So enrollment would not normally be open right now. Is that correct?
That is correct. Open enrollment is an annual timing that happens between November 1st and December 15th in the state of Illinois. However, as you were saying in the beginning, people can qualify for a special enrollment period, which is sometimes referred to as an SEP, if they experience certain life qualifying events.
So that is interesting, because that's another bill that we were working on just this year, was working on special circumstances before the COVID came, of what special circumstances come along that do change the enrollment period. So what are some, outside of open enrollment, and we know right now it's continuing open because of COVID, but what would you share with us, what are some circumstances right now that qualify?
Sure. One of the biggest ones that's is significant to a lot of people right now is loss of coverage due to job loss. Due to COVID-19, there's been an unprecedented number of people who have lost not just their employment, but their employer-based insurance. And those folks qualify, many of them qualify for within 60 days, a special enrollment period to enroll in a new plan. So timing is important. There is a list of other qualifying events as well, and people can visit getcoveredillinois.gov to find a more detailed list of the other events. I can tell you that there are some such as moving, having a baby, but there is a detailed list on the Get Covered Illinois website.
Okay, so let's recap, the teacher in me, let's recap that a little bit. You can go to getcoveredillinois.gov. That's .gov, remember, getcoveredillinois.gov. And you can check on that for anything that you might need as far as figuring out if you're eligible to sign up when you're not in the open enrollment period. Of course, right now with COVID, it's open because of COVID. Now, the other thing is other qualifying life events sometimes will allow you to sign up at a different time. So if, for example, if you had a baby or you moved or something, you will want to look at that, figure it out, and then, like Laura said, you have 60 days, is that correct, to sign up?
That is correct. In most cases, it's 60 days. Something else to consider is that you have that window of time, but other than that, there's open enrollment period, which starts on November 1.
Okay. So open enrollment starts November 1, and how long does that go?
That goes through December 15th, so it's basically 6 weeks. And during that time, anyone who's not currently under an insurance plan you can change your plan as well as enroll in a new plan. You have options. Same thing with if you've lost your coverage, or if you have coverage but you want to change your plan and you've lost coverage, you have 60 days.
So I'm thinking about things going on right now with COVID, and what about if a person had insurance with their job and now their job is such that they don't have insurance coverage anymore? Can they sign up for this?
Yeah, so they can sign up as long as they had insurance coverage before with their employer. So if a person chose not to have coverage through their employer and did not have insurance, they would not qualify under this type of special enrollment period. They would have to look to see if there's another special enrollment period or life qualifying event that would work for them, for their situation.
Okay, and in that case, if they weren't on their work insurance, now they've decided with all this, they can probably get on in the open enrollment for their work. That's when they could get on?
Well, not through their work per se, but through the ACA marketplace, they can enroll. Open enrollment, yes, they can enroll, but that would be starting November 1.
Okay, and for our listeners out there, the ACA marketplace means the Affordable Care Act, and the marketplace is a little catchphrase for these are your choices of your types of insurance that you can sign up for. So as long as you're a U.S. citizen, you can check into this and possibly apply. Is that correct?
That is correct. And just to stipulate, for those folks who may have lost their income entirely, there's a chance they could also qualify for Medicaid. That is not my area of expertise, but Medicaid, people can apply at any time. So just something to keep in mind.
Okay, let's repeat that. Medicaid can apply at any time.
Correct.
So if you're a Medicaid recipient, you don't have to wait for the open enrollment.
Correct. Or a qualifying event. Right.
Or you don't have to wait for either one. So Medicaid,
correct,
any time of year, you can apply. Okay, let's see, what's the next question I have ready for you here? You've already talked about when do we apply. What material and information should we have ready when we come and apply with you?
So when you go to the website at getcoveredillinois.gov and you choose on enroll or compare plans, it's going to take you through several questions on the website, and that'll include what your current household income is, how many people are in your household. There'll be a number of questions they're going to ask you, and then you don't necessarily have to have forms ready right in front of you if you can answer those basic questions, and that will kind of walk you through what kind of insurance plans and the costs that would be specific to your situation.
Okay, do you, the person applying, do they need to have any special proof that they qualify?
So for special enrollment periods, there would be potentially information they have to share to show that they qualify for that special enrollment period. So it really depends on the person's circumstances and
Okay.
what qualifying event they're saying that their situation is. And yes, they would have to be able to show that. And depending on their circumstances, the documentation would be different. So it's unique to the person and their situation.
So would you recommend that they call, like, do they come in to you for an appointment, or do they just go online and do this?
So typically they could come in person, and they can go online, they can call. However, during COVID-19 and our current circumstances, on site, there's help online as well as by phone.
Okay.
I'm happy to give you that. Again, you start at getcoveredillinois.gov, but there is free assistance through navigators, and those folks just basically answer questions. That sometimes insurance can be confusing.
Yeah.
And they kind of walk you through, and they're not going to give you their opinions on what plan to choose. However, they can answer the basic questions somebody might have that doesn't understand certain terminology, or how two plans might be different.
So they'll help explain the plans, and then it's up to the constituent to decide which plan they want to take.
Correct.
And there's different prices and different coverage, right?
There are different prices and different coverage. I know one of the questions you had sent me before was regarding levels of coverage or categories. Mm-hmm. So in health insurance, they're referred to as metal categories as well. And there's gold, silver, and bronze. Those will vary in price, and that has to do with out-of-pocket expenses. And also sort of what you and your insurance company, depending on what you pick. The quality of the plans are all the same in the ACA health insurance marketplace.
It's just
so no matter what plan you pick, right, sorry, yeah. Okay. No matter what plan you pick, you're going to get the same good coverage. It's just the pricing will be different depending on the level of the plan.
Okay, all righty. Okay, why should constituents take advantage of this opportunity?
Well, as we know, health insurance is such an important thing to have in your life, because you never know when there might be something unexpected. Even if you're typically a healthy person, someone in your family could have an accident or an unexpected illness, and hospital bills are expensive. They can set you back thousands of dollars if you don't have insurance. So it's just a good idea to have it for peace of mind.
Okay, and then following up to that, is a person eligible to enroll if they are offered health insurance through their employer? Like, let's say, you work at a company, your employer offers you health insurance, but for some reason you would rather get the Affordable Care Act insurance through the government. Is that allowed?
If you're getting insurance through your employer, then you would go through your employer. However, you're always able to compare plans to see where the best pricing is for you. Typically, if you're getting insurance through another means, though, then you would not go through the ACA marketplace.
Okay, and if you do during, like right now with all this, if you do sign up, when would your first payment be due?
So typically your payment is due shortly after you sign up. It would probably be it's going to depend on the insurance carrier. So when you go with a plan, your best bet is to contact your insurance carrier to find out exactly when that date will happen, but it'll be shortly after you sign up for the plan.
So if you sign up for this plan, you will have an insurance carrier. It won't be the state?
No. So the state of Illinois does not run the plans. We help regulate the insurance plans. In our case, from Get Covered Illinois, we're outreach and education, so we're just letting people know about what their options are and what's available. But no, we do not sell the plan. So the health insurance plans are sold through insurance companies, just like they would be if you went online. However, these plans follow the ACA Affordable Care Act. They'll include the essential health benefits, which may not be available on all plans that are offered in other places.
but the price would be the price that you tell them about. I mean, they don't
Correct.
agree on the price with that company, right?
The pricing is what it is, depending on what people choose in terms of their, their healthcare options and the metal category they choose. So that is not something that we are directly involved with when it comes to the pricing and negotiating that with for individuals. So no, but people wouldn't sign up for a plan until they see and understand what their expenses would be.
Do all these plans with all these different companies have a gold, a silver, and a bronze?
So there's over 140 different plans that are available within the state of Illinois, and that will vary in terms of carriers and plans from county to county. However, most of them will offer the 3 levels, but maybe they may not be available in every county. So that's something to look at when you're comparing plans.
Okay, and if you live in a certain county, then that's the county you need to apply through? Or are you all
sorry, go ahead.
Illinois?
So when you go through the process to enroll and compare the plans, you'll type in your zip code, and it'll tell you automatically what plans you qualify for. And then you can compare from there. So you don't have to figure that part out for yourself. You can just plug in that information, and it'll tell you what plans are available.
Right. I know it can be very stressful. I have had friends start new jobs and call me and be like, I don't know which way is better. And when it's funny because I just walked a friend through this while we were in session. She called desperate, and so 6 o'clock in the morning we were working on figuring out which plan. But I can tell our viewers from the constituent side, if you can find someone to help talk you through this, it's helpful. If you can't, I'm sure when you call our navigators here with the affordable care, that's what they're here for, is to help you figure out, not necessarily tell you need to do this or that, but say, look, if you do it this way, it's going to cost you this much, and this is what you're going to get for it. And if you do it that way, it'll cost you this much, and this is what you get for it. Now, think about your life. Do you go to the doctor a lot? Are you not real sick? Are you likely to have a big surgery coming up? Those are the kinds of things, and I know none of us have a crystal ball, but everybody's different. And if you're a super healthy person, you're going to want a different plan than someone who's like, no, I go to the doctor every month and I pay for lots of medicines. And so you would want a different kind of plan. So those are the kind of things that the navigators are very good at helping you with. And now, would they be able to call and get information and then maybe talk to a friend and then call you back? Would that be allowed?
I might need a little more clarification. So you're saying the person who talks to a navigator wants to check in with somebody else and then call the navigator back?
Right, like you might call the navigator and ask them all these questions and get all the information, and then you hang up, call your friend or loved one, and then you call them back and say, okay, we've decided we want this plan, and then now can you help us figure out how to sign up for, like, let's say the silver plan?
Sure. So what I would recommend, I think is a really good idea for all people that are looking into ACA Marketplace plans. When you go to the getcoveredillinois.gov website, there's a button that says make an appointment. On there, when you put your zip code in, you can actually look for local assisters in your area.
Oh,
when
awesome.
you do that, so yeah, which is nice. So you can even say how many miles from where you live, and you can see who's available. So they're in your area. At some point, they'll be available in person again. But right now, you can call and have an appointment. And when you're talking to those local assisters, it'd probably be a lot easier to get back to maybe the same person, but you'd at least be able to talk to the same organization again that's assisting you.
Okay, that's great. So it says here that you can start an application when you call the navigator. So you can get it started, and do you have to go all the way through to the finish line, or can you start it and then pause?
So you can start it pause, especially if you have multiple maybe family members that you want to discuss your options with, and bring it back or apply, so it doesn't have to be all in one visit.
Okay,
So
that might relieve some stress from some people that might think, oh my gosh, if I call, what if I can't decide what to do right away? Then that's totally fine. You can go talk to your husband, your mother, whatever, and then come back and continue. It does not have to all be done right there on that spot.
No. Yeah,
Okay.
It's definitely, for a lot of people, it's kind of an overwhelming experience. Even if you get it through your employer and you have specific plans that you get to choose from, and you've limited options. When you're out there shopping on your own and you're on the website and the internet, it can be really overwhelming. So Get Covered Illinois is a great place to start, because that's the place where you can find out if you qualify for some kind of financial assistance or tax credits. So it's always a good place to start there.
Okay, that's something we didn't think to touch on. So some people get assistance with paying for this?
That is correct. So they would go through that application process, and they would answer the questions about, like I said, their income, household, for people who may have lost their income because of job loss. Like I said before, those people may even qualify for Medicaid if they have no income coming in. So the best place to start is Get Covered Illinois, because they'll go through those questions with you, and they'll, based on how you answer them and what your current situation is, will determine if they say, okay, you qualify for Medicaid, or you qualify. Some folks may not know what the age difference is for Medicare. Some families, their kids may qualify for the All Kids program. So it's really a good place to start. Also, like, depending on your income level, lower income families could qualify for tax credits. So maybe they don't qualify for Medicaid, but they may qualify for tax credits, which is basically getting money off of your health insurance payments from month to month. So it's just a good exercise to go through and see.
Okay. So something that just came up now, one question leads to another. The All Kids, can you tell us what that is?
I can tell you a little bit about it, but that actually is under the Medicaid program, so I'm not an expert on that. But All Kids Medicaid has multiple programs, and All Kids is one that's specific to children and child health care benefits. So I really can't get into the details. I apologize. I don't want to misspeak on what the benefits cover. But that's definitely, also, just so you know, the ACA Marketplace, when you buy a plan on there, there's also coverage for mothers and newborns, pediatric care. So something else to consider depending on where you fall financially and what
so you could get coverage for your children as well as you and your spouse. Could it be for your whole family?
Oh, most definitely. Yes.
Okay. Yes. That's important for people to know, I think. Okay, so definitely. While we're at it, I know this isn't this topic, but if anybody's wondering, the age to start Medicare is age 65. Is that correct?
That is correct.
So, and I believe you have to sign up like within 2 months of becoming 65 or something like that.
It's good to sign up in advance, just so that there's no what's the word I'm looking for? A skip, and not skip, but a time coverage where you're not covered. So this way you're covered like throughout, a lapse. Thank you. That is the word I was looking for. So you don't have a lapse of coverage.
Okay. And a friend of mine, I'm not, this isn't gospel, but my friend said you have 2 months before your 65th birthday, and your birthday isn't the day of your birthday. It's the first day of the month you're born. So, whether that's right or not, I can't swear to it, but just to pass that along, you might want to check into that. Or maybe Laura, I don't know.
I think it's a good rule of thumb to do it the first of the month, just in terms of when coverage begins. So I don't know if that's an exact rule, but I think in terms of planning for it, it's a good practice to follow.
Okay, I know as a teacher, I want to go through these terms again in case we lost anybody. I know when I hear letters, I just want to scream, what does the letter mean? So Get Covered, so it's GETCOVERED, and then Illinois.gov, G-O-V. That's where you go on the internet You can Google that, or, put it in whatever, Safari, whatever. And then from there, it will direct you of how to get your insurance. Now, ACA means Affordable Care Act. I don't necessarily want to use the term Obamacare, but for those of you who just know it that way, it used to have that little saying that it was called Obamacare. But basically what ACA, Affordable, is that right? Is it ACA or?
You're correct. You're correct. And that's where it can be confusing because there are multiple names that people use to refer to the marketplace. The healthcare exchange is something else that people call it. Obamacare, based on, the act that created all that coverage for folks. But the ACA, Affordable Care Act marketplace, is the marketplace where people can go and potentially get tax credits and assistance.
Okay. So if you hear ACA, we're talking about a public opportunity for anyone to get insurance that doesn't have it for some other reason. What about pre-existing conditions?
So pre-existing conditions is covered. It's one of the essential benefits covered by the Affordable Care Act and by all the plans that are offered on the marketplace.
Wow.
So that's something to keep in mind when looking at insurance, because if you're not on the government website, the Get Covered Illinois or healthcare.gov, and you're looking at other insurance websites, you have to be careful to make sure that the essential benefits are covered, because they may not all be covered if you're going through another insurance carrier. Just something to make sure you're looking at when you're looking at plans.
So if you have a pre-existing condition, you may very well be able to get your insurance through the Affordable Care Act.
You definitely can. Anyone with pre-existing conditions, and those are questions you want to ask when you're looking through plans. If you don't see that it's clear, you need to make sure you ask that question. That's a big one. Preventive care is another really
navigator, right?
Right. And preventive care is another big one. So, I mean, the difference between a navigator and an agent or broker, if you go online and you see sites where you see, wow, these prices are so much lower, this is great. You just need to make sure that, like I said, the benefits you want, preventative care, essential benefits, prescription benefits, those things are covered. Like I said, not all plans have essential benefits covered, and you want to make sure you have those when you choose a plan.
Okay, let's, and I appreciate your patience. Let's back up a little bit here. Preventive care is like you would go to the doctor to get, let's say, a mammogram to prevent getting cancer. That's what, prevent getting breast cancer. That's preventive care. So you might want to check and see if they have that as a coverage. Pre-existing condition is you already have diabetes, let's say, and you're going to try to get insurance. You need to find out and make sure that they will accept you knowing that you've had diabetes for 20 years already. It's not something new that you're getting. Okay, and then you said the healthcare.gov. What is that?
Okay, so the marketplace, Illinois, state of Illinois, we are on the federal government marketplace. So when people go to healthcare.gov and they enroll in a plan, they're automatically connected to healthcare.gov. So, if you start at Illinois or getcoveredillinois.gov, as we've mentioned, when you go to enroll in a plan, that's where it basically connects you to. So it's the federal platform.
Okay, so getcoveredillinois.gov is the Illinois part of it, and then healthcare.gov is the federal part of it.
Correct.
But a person doesn't really need to know this. It will just walk them right through that.
Right. It's an automatic process. So I'm just saying, like, the .gov basically implies that, you're in the right place. You're going to get a lot of other websites out there. So if you're trying to find the marketplace, a lot of people will advertise themselves with using the term marketplace or exchange, but to know that you're truly there, start with Get Covered.
Okay. And we are going to put this on our Facebook in the regular print. We will put getcoveredillinois.gov. And I keep repeating this because I know how they try to trick you. These fake companies will have the same thing with a .com or a .org, and they're just being dishonest. So you want it to say .gov, and then you know you're safe. And we will also put your phone number, but if you would like to give us the phone number, and the term navigator might throw people off. So we'll get your phone number in a minute, but will you explain to us what a navigator is? We've mentioned that several times.
Sure. So navigators are folks that are trained and certified to, like I said, give their, to answer questions about the ACA and the marketplace, and to help you answer questions that you might have when you're comparing plans. So those folks are, they're objective. They don't give their opinions. They just give the information. There are other assisters that can help. There's certified application assisters. They also fall under the same category. They are trained and certified to help people, and they're not working for someone else and swaying you one way or another to purchase a particular plan. They're just going to give you the information straight out and answer your questions.
And through this, they are eligible to use telehealth medicine, correct?
So telehealth medicine has been expanding more and more, especially due to COVID-19. That being said, depending on the plan you're choosing, you need to see what that coverage is. So that's something else to look at when you're covering plans, because in the state of Illinois, for sure, telemedicine is expanding quite a bit. But to be sure what you're being covered for, you should really check that insurance carrier's plan.
And let me throw in again another term, telehealth medicine. What telehealth medicine is like what we're doing right now. I sit in the safety of my own home, and the doctor is on the other end of the computer screen, and I could show him my throat, and the doctor can look in my throat, and I don't have to actually go in the doctor's office. Or perhaps it's for mental health, and you can talk to your counselor or your social worker right there in your home. And it's not that the doctor comes physically to your house, it's that they're at the other end of the computer. I know for some people this seems extreme, but for others that have never heard of it, I saw someone this morning with that deer in the headlights when I said the word census. They had no idea what I was talking about. And it just reminded me that we need to be fair to everyone. So thanks for enduring as I explain some of these terms.
Oh, no problem. I agree. It's important. It's very important.
Yes. Okay, so what is the phone number then?
So the phone number is for healthcare.gov is 800-318-2596.
Okay, so if you're going to call healthcare.gov, you dial 1-800-318-2596. Now that's healthcare.gov. How do you call Get Covered Illinois?
So Get Covered Illinois, and it's funny because that number I don't have right in.
How do we talk to a navigator at Get Covered Illinois?
So Get Covered Illinois, like I said, you go to the website Get Covered Illinois, and I am going to, 1 second, and I will.
Oh wait, I've got it right here.
You got it. Yep. Thanks,
Can you
Brian.
see that too?
So yeah, so the number for Get Covered Illinois directly is 866-311-1119.
Okay, let me.
I apologize for not having that right at the top of mind.
Let's go through this. Get Covered Illinois' phone number is 866-311-1119. Okay?
So just to add to that we would want people to start with the website getcoveredillinois.gov and go to the navigators that you can go through there. And that way you can type in your zip code and get a local assister. And then you would get their phone number as well if you want to talk to somebody who's in your local area. So,
okay. So best to start online and then walk your way through to find, and you called this an assister? This is
right. It's another, yeah, it's just another term that's used to assist people. Navigator and assisters is both terms work.
Okay. At first I thought you were saying sister, and I'm like, oh,
no, sorry.
So an assister is someone who helps you or assists you. Okay. All right. All right. I think that's everything. You guys have been so helpful. Um, I can see where I'm going to need to play this several times on my Facebook Live. So if you're watching now, you can always go back to the beginning and watch it over and over again as many times as you want. If all you needed was the name of the website and the phone number, we will be posting that on Facebook right away. And then we will keep popping this up to the top for a while and every so often, just so that people can remember. But if you have a friend that you're trying to tell about this to the folks at home, very simply, today is, believe it or not, the 1st of July. So if you go to my Facebook on the 1st of July, you will get this information. So you can tell a friend, go to Sue Shear's Facebook Live on July 1st, and you can read it all and listen to it all that day. But we'll also pop it up other days. Did you have anything else you think that people need to know before we end, Laura?
No, I would just say to keep in mind for those folks who may have lost their employer-based insurance, that 60-day window, and take the time to look and compare plans so you know what you're getting. Don't forget to, if you have questions, to speak to an assistant or navigator. They can really walk you through and answer those questions for you. I'm happy to send you a couple of resources that you can share online with your constituents.
We'll be happy.
But I can send you, I can send you after this with some helpful websites and phone numbers, so they're all there for you.
Okay. That reminded me that I would like to give my office phone number too. It's 217-877-9636, or you can email me at staterepsue@gmail.com. And those are other ways. If you don't quite understand what's going on here, we can try to help get you back here to square one. That's our job, is to try to help you with that stuff. So I think we're all set. Oh, you did say they have 60 days. So if you lost your job June 1st, then basically you have till July 30th to sign up. Is that correct?
That should be, and again, it's always good to check, but so for almost everyone it's 60 days, but that would be right based on June 1st, yes.
All right, what happens to somebody who lost their job back in March? So now the 60-day window is up.
So in that case, they would have to wait for open enrollment period unless there's another special enrollment or life qualifying event that would qualify them to enroll. So it's always good to check that list. Yes. And to make sure, but there's a chance they could have some other situation that allows them to apply sooner. Okay,
so for sure they can jump in November 1st, and if not, they can look at the list and try to get in with some other qualifying life situation.
Right, and as we mentioned before, just keep in mind about Medicaid. Depending on their situation and their income, and if they lost their income, they could qualify for Medicaid, and they can enroll in that at any time.
Okay, so if you lost your job, you have no money coming in, you could go through Medicaid, and you do not have to wait till November 1st for that. That's good for people to know. Very good. This has been one of the most valuable things that we've done, and I so appreciate your time. And to our viewers, I hope this was helpful to you. If you have friends who are concerned about this, this is an excellent resource for them to watch this and then look at the follow-up information. So we will close out then. Is there anything else that you needed to add to it?
I don't think so, other than we greatly appreciate the opportunity, and if you get questions where you need assistance moving forward after this, just let us know.
All right.
We're here to help.
Thank you, everyone. And as I always say, I care about you, and that's why I do this job. So God bless you, and God bless the great state of Illinois, and God bless America. Have a great day, everybody.